Hello students, welcome back. Today we are going to see the last topic of the chapter, drug and alcohol abuse. Now, drugs and alcohol abuse, it can be asked for a short note 5 marks, or each of the topics can be asked for 2 marks. Let us understand what is drugs and what are the abuses of the alcohol. So when drug and alcohol are taken for purpose other than the medicinal, or taken in the amounts or frequencies that impair either physical, physiological, or psychological functions, it is called drug abuse and alcohol abuse. So, if such chemicals are taken other than medicine purpose, or if their quantity is higher, or if they are taken regularly, then it is called drug or alcohol abuse. We have different type of drugs: opioids, cannabinoids, coca alkaloids, that is cocaine, hallucinogens, and then we will see tobacco and alcohol. Let us come to the opioids. Basically, you might have heard heroin, which is a depressant, or it is a depressant, and it slows down the body functioning. What is the source? Morphine or morphine, which is extracted from the latex of the poppy plant, Papaver somniferum. Heroin is obtained by acetylation of morphine. So if you just acetylate this, we get heroin, which is white, odorless, bitter, crystalline compound, and it is also called smack in drugs language. So opioids, again I am saying the source, from the latex of the poppy plant, Papaver somniferum. Heroin is obtained from this morphine, just you have to acetylize. So acetylation of morphine gives you heroin, and which is white, odorless, bitter, crystalline compound, which is called smack. What is the mode of intake? Either by snorting or injection. So people used to have a piece of paper and then they just snort it out, or either by injections. What is the mode of action? They bind to specific opioid receptors in the central nervous system and gastrointestinal tract, both. So what are its effects then? It is a depressant, so it slows down the body functioning. Morphine is an effective sedative and painkiller useful in the patient who have just undergone surgery. So morphine is good if it is given by doctors under medical supervision, because it acts as a painkiller. Now, so if it is used other than as a painkiller, if it is used regularly or frequently or more than the quantity prescribed, then it is called drug abuse. So this is about the opioids. Let us see cannabinoids. It is obtained from inflorescence of the plant Cannabis sativa, flower tops, leaves, resins of this plant in various combination produce either hashish, charas, marijuana, ganja. This is the common names which we use in a local language. What is the mode of intake? Either by inhalation or by ingestion. What is their action in the body? So they interact again with the cannabinoid receptors, which is present in our brain. And what does it do? It affects the cardiovascular system in the body. So cannabinoids, again a very important drug. The next, cocaine or coca alkaloids. It is again obtained from the leaves and the young branches of the South American plant called Erythroxylum coca, that is cocoa plant. Cocaine is commonly known as coke or crack. What is the mode of intake? Either by sniffing or snorting. Mode of action, it is potent stimulating action on central nervous system that interferes the transport of neurotransmitter dopamine. So it interferes with dopamine and it interferes the action of CNS. What are the effects? Again, it's a strong stimulant of CNS, central nervous system, and it produces a sense of euphoria and it increases the energy. So when taken in excess, it causes headache, convulsions, hallucination, and even death due to the either cardiovascular or respiratory failure. Then what is hallucinogens? Again, it's a source from the plant Dhatura species and Atropa. So these two plants produce a chemical called lysergic acid diethylamide, LSD, which is again derived from Claviceps purpura. Plants with such properties have used as medicines in some religious ceremonies and rituals. We all know that. So hallucinogenic properties are used at some customs, some religious purpose. So what they do? These drugs are called psychedelic drugs because of their effect on the cerebrum and sense organs. These drugs affect our thoughts, feelings, perceptions of an individual. Medically, these are given to the patient to cope up with mental illness like depression and insomnia. So hallucinogens is common things. See, most of the times you feel, you have just closed the door and then you just turn back and again you think that someone has passed through your. These are called hallucinogens, something like that. You just think something has went from your side. So such things are occurring regularly. Then tobacco plant is common in most of the region in our country. Either it is smoked, either it is chewed or used as a snuff. It has nicotine chemical, an alkaloid, which stimulates the adrenal gland, which releases the adrenaline and noradrenaline, in which it increases the blood pressure and heart rate. So smoking increases the chances of lung cancer, bronchitis, coronary heart disease, cancer, and many of the things. Again, it increases the carbon monoxide content of the blood and it reduces the concentration of heme-bound oxygen. As a result, oxygen deficiency occurs. Chewing of the tobacco, oral cancer, most of the chances of oral cancer. So this is about the tobacco. Then alcohol. Mode of intake is obviously oral. Alcohol has anesthetic effect on the nervous system, affecting the cerebrum and cerebellum and even other parts. So alcohol consumption is seen in most of the young generation. Because it causes an euphoria, a good sense. You might feel that you are flying in the sky, but it is not like that. It has many issues. It affects peptic ulcer, it causes peptic ulcer, it has gastric carcinoma, hepatitis, liver failure, liver cells are damaged. It also causes euphoria, that is the part of the alcohol abuse. Then we have addiction and dependence. See, the psychological attachment to certain drugs, such as euphoria or temporary feeling of well-being associated with the drug and alcohol is called addiction. So we know we have addiction of tea, addiction of coffee, but most of the people have addiction of alcohol and drugs. So the psychological attachment to the certain effects, such as if you feel that if you have that, you will feel better. That is a psychological effect. If you don't have it, you feel nervous, you feel uh, you lose your control. So that is addiction. And people take drugs or alcohol when not needed, but with repeated use, tolerance level of reception in body increases. Receptors thus responds to the higher dose and leading to greater intake and addiction. So what happens? Every time you take either drug or alcohol, the next time it will demand more in your body. You will be not satisfied with the amount which you have taken the previous time. So you take more and more, and this causes you more addiction. You have seen this alcohol abuse or drug abuse in our adolescence period, mostly the young children. Why? Maybe social pressure is there. Curiosity, adventure, excitement, maybe experiment. Sometimes it may be because to escape from the stress, frustration, depression. There might be some hardships in the life, so to overcome that hardships, maybe some unstable or unsupportive family structure is there. So sometimes to relieve the stress, maybe in academics, the peer pressure or pressure from the family, especially in the exams. So these all are the reasons why young generation move towards alcohol and drug abuse. So the tendency of our body to manifest the characteristics and unpleasant withdrawal syndrome on abrupt discontinuation of regular dose of alcohol or drug is called dependence. So what is withdrawal syndrome? Suppose if you stop, if you think that okay, from tomorrow I will not take alcohol or drug, but your body tends to react in various ways. That symptoms, you might have seen one of the movie of Sanjay Dutt also, how withdrawal syndrome starts. Sweating, diarrhea, depression mood, anxiety, nausea, vomiting, insomnia, restless, irritation, angry. You may murder anybody. Such kind of angerness is there. So that is called withdrawal syndrome. And this is dependence. Withdrawal symptoms are at the peak of first and second day of the once you have stopped intake of such alcohol and drug, and they disappear after 3 and 4 weeks. 3 to 4 weeks it takes time, then they go. What are the effects of the drugs and alcohol abuse? Alcohol has anesthetic properties, which we have discussed, which affect the nervous system, affecting the cerebrum, followed by cerebellum and other parts. So sometimes it has bad effect on our judgment, willpower, self-control. It loses our emotional control, it loses our moral sense. Sometimes it has a visual problem, incorrect speech, staggering speech. Inflammation of the axon and the neuron is been also seen. What happens to the male, the side effects of drugs to the male? Acne issues are there, aggressiveness, reduction in the size of the testicles, decreased sperm count or production, premature baldness, enlargement of prostate gland, mood swing, depression, breast enlargement, potential for kidney and liver dysfunction. These are the effects on the male of drug abuse. What are the side effects of drugs on females? Masculinization, aggressiveness, mood swing, depression, abnormal menstrual cycle, enlargement of clitoris, excessive facial and body hairs, and deepening of voice. So side effects of drugs on males and females is always asked for 2 marks or maybe 3 marks. Now, there are some warning signs of the drug and alcohol abuse. Suppose if someone is continuously dropping in academics, absence from school and college, lack of interest in personal hygiene, isolation, depression, deteriorating relationship with family and friends, fluctuation in the weight, loss of interest in hobbies. These are some symptoms which you can find. Those who take drugs intravenously are, we have already discussed, at a risk of AIDS and hepatitis B. The chronic use of drugs and alcohol damage the nervous system and the liver, that is cirrhosis, and alcoholism during pregnancy affects the fetus also. So the best thing is prevention and control. So how can you do that? Avoid undue pressure. Every child has his own choice and personality, so we should not pressurize that child for a particular thing. He might be good in sports, not much good in studies. Educating and counseling such children. Seeking help from parents and peers, friends. Looking for the danger signs, especially parents and teachers should be very careful when they are interacting with the students, and they should know about the students, how much the student is concentrating, he's regular in the class, he's mixing with the other students, either he's depressed or not. In such conditions, we can find out whether he required any help or not. So prevention and control is very important. This is the topic, always it is asked in the board exam, maybe 2 or 3 marks. So I request students to use each topic, like note on opioids, cannabinoids, coca alkaloids, hallucinogen, tobacco and alcohol, and the effects of drugs on males and females, even definition of addiction and dependence also to be studied properly. Make a note of it, and it can be asked for 2 or 3 marks individually, and a whole note can be asked for 5 marks. Okay, I hope the topic is clear. If you have anything to ask, please ask me and comment me back or WhatsApp me on my WhatsApp number. We'll see next chapter very soon. Thank you.